comes to eyes, the earlier our doctors can catch any potential problems, the better. That's why it's important to make sure your child is getting proper eye care.
And where, though, and when, for Pete's sake, do you start? Well, joining us today to help us figure that out is Dr. Todd Bescak, who's an ophthalmologist at Chesapeake Eye Center, PA, with locations in Berlin, Salisbury, and Millsboro. Did I get that right?
You did.
Okay, good. Now, I wanted to ask you, because I understand this is National Children's Eye Health Care Month.
It is.
We're talking kids. I don't understand how you can give a child an eye exam. When do you start? How do you do?
Right. Well, there's a lot I want to get into today, but the beginning of life is so very important for our eyes and our visual development. So that's why this is so important to get this message out there, because there's certain diseases, certain illnesses that can happen to the eyes that if they're not corrected early in life, it sets you up for poor vision for the rest of your life. So that's why this is so vital. I recommend that we have our first eye exams before age 5, really before kindergarten is what we're looking for. Now, of course, there are caregivers, pediatricians, people in children's lives that can notice maybe if something's suspected.
Right.
And if those things are suspected, of course, we'd like to see them sooner than that. Now, it's not really until the child turns maybe 3 years old before they can read a vision chart and tell me A, B, or read the pictures that are up there. And there's some tricks we can do before that. We'll get into that in a minute. But as a rule of thumb, unless there's something suspected, before 5 years old.
Okay, now at age 5, you know, we see the eye charts and there's letters and on there. Are not all children, they're just learning to read the letters. So how do you do the eye exam?
Yeah, well, we have, first of all, as far as reading the chart, there are some that have some pictures that are involved. And generally, children can pick out the pictures, teddy bears and things like that. Not too difficult to figure that out.
Right.
So we work through it. A lot of the exam is some science and a lot of art. There's a lot of trickeration that has to happen in an exam to try to get the correct diagnosis with a child.
Now, you said a lot of, with the caregivers and the parents and can help as well. Is there anything we should be looking for that our kids are doing that you may suspect something's wrong?
Absolutely. So what you're looking for, and I think we have a graphic for this, you're looking for a child that's rubbing their eyes, squinting, maybe closing one eye. It's often common to have a head tilt. If a patient or a child has double vision, they may tilt their head in order to get the double vision corrected.
Okay.
Trouble reading, frequent blinking?
Frequent blinking. Now, that could be a sign of dryness, could be a sign of difficulty seeing, just blurred vision. They're trying to blink just in order to see better.
Right.
Is there anything we can physically look for that might be an indication that there could be?
One thing that parents, moms and dads are really good at finding is misalignment of the eyes. Eye turning in, eye turning out. That can be a sign of terrible things possibly going on inside the eye. You also want to look for watering eyes, discharge coming out of the eyes, kids rubbing their eyes all the time. Oftentimes my patients' parents come in and say, my child's sitting too close to the television. That may be a sign of something, but every child I've ever seen likes to sit 1 foot from the television, so that's not the end-all be-all of symptoms.
All right. Now, what about lazy eye? You talked about, misalignment of eyes. Is that what that is, or...?
In part, lazy eye, or in our world known as amblyopia, it's an abnormal communication between the brain and the eye itself. And that happens because one eye actually gets ignored by the brain. Sometimes one eye sees very clearly and the other eye doesn't. And when that happens, the brain ends up putting more emphasis towards the well-seeing eye and starts to ignore the poor-seeing eye. And when that happens, the poor-seeing eye can end up sometimes deviating outward or inward.
Ah, okay.
So that's a sure sign of if that deviation is going on, you need to come in and get an eye check.
So as an ophthalmologist, you examine kids. How do you do it?
Well, as I said earlier, it's a skill that's learned over many years, and you have to become quite good at getting quick pictures mentally of what you're seeing, because you may only get a split-second look at the vital structures.
Have you got special equipment?
We do. So we also have some more graphics of some of this equipment we have in the office. This is a picture of me doing a slit lamp examination. This is a microscope that allows us to get a nice close look at the very front part of the eye there. We can look for abnormalities like dryness of the eyes or allergens of the eyes. Now, this is called ophthalmoscopy, where we're looking towards the back part of the eye, or the retina, where we can look for things like macular issues or optic nerve problems, such as early glaucoma.
Okay.
This final picture is one of something called retinoscopy. A question I often get asked is, how do you determine a prescription for a child who isn't able to tell you which is better, one or two?
Right.
For instance, if I had you in my chair, I could say, which lens is better?
One or two.
One or two, and you're able to do that. Now, a 2-year-old's not going to get that concept, might not even know what I'm asking. So I actually brought a little prop in today. Whenever you have an eye doctor on, they're going to bring something.
They're going to bring something.
Yeah, this is what I brought today. So this is called a retinoscope.
Okay.
And what this does is, as I hold this up to my eye, I shine a light onto yours.
Okay.
And it has a lens here, and I'm seeing the reflection come back from that.
Okay, show me how this works.
Now I'm looking for a perfectly clear reflection coming back.
And you can see that on the back of my eye.
And I can see that the reflection coming off the back of your eye.
Oh, okay.
Now, if you remember the old clock game from Price is Right, where Bob Barker, you would be bidding on an oven or something, and you'd say 100, he'd say higher, and then you'd say 300, he'd say lower. Well, this sort of works the same way. I brought 3 lenses in, but I have a bunch of lenses, and I'm looking for the correct prescription.
To get the
I'll know if I have to go up or down, and eventually I'll get it right on the money, and that's the prescription that the child should have.
All right. Now, of course, we want our children to protect their eyes to begin with. So what are some of the things that we should stress they do?
I recommend to everyone, and children included, sunglasses, especially living on Delmarva, where we're exposed to harsh light conditions. We're exposed to ultraviolet light by way
they look cool,
they look great. Look at this fine-looking young man here.
You know him, don't you?
A little bit. That's my son.
But get sunglasses.
Yeah, so the sunglasses are important because protecting from ultraviolet light can set us up for many things. Red, irritated eyes.
Right.
Unfortunately, the eyelid area is a popular area for skin cancer to develop. Ultraviolet protection by way of sunglasses can protect from that.
Take care of that too. Dr. Todd Bezak, thank you so much for joining us this afternoon. A lot of great information.
Thanks for having me.
Very much. Thank you.
Wow. And if you missed any of those symptoms, or for more on what parents should look for when it comes to their children's eyes, go to delmarvalife.com and click on the Show tab.
Still to come on Delmarva Live, full lot of us have had to deal with bouts of back pain. We'll look at some common causes and what you can do to get some relief.
And for smokers, it might just be a simple solution. Delmarva Life, life at its best here on Delmarva.